Hello, doctors. Good evening. I hope you all are doing fine and you're studying smart and studying hard. Okay. So this is a quick video. Quick, uh, video. I'm doing it just just for those who are struggling in terms of where to start preparation or for the lab exam. Well, because I have seen many of the candidates who just pass lab exam, they just join here, there, every group. It's good to join groups. Well, you do join groups, right? You do listen what they're saying. It's always good. But the thing is, you need to stick to your things, okay? Right? First of all, you need to learn your basics. I always say to all of the candidates, please stick to your basic. Know your approaches, know your basic. What this I mean is that please try to learn how to take a history. That's your base. If you know the approach of taking history, believe me, you will do any station without any problem. Okay, this exam is not to check how much do you know, because they have already checked your knowledge in the part one. The part two is just to check about your communication skill. Basically, the way you talk to the patient is more important for them. Okay, so first of all, you need to learn how to take a history. You can learn history from any source which you want, which you like. Make a grip of that part of history taking. That's your backbone to ace this exam. Without that, you will pick up your notes, you will waste your 1 month, and you will still struggling, and you will still looking for the answer. Why we asking this question? What's going on? This is too much. I'm not unable to finish this. This is too much for me to finish. There are so many stations. How I'm gonna do that? So to get overcome these things, I highly advise you to please follow your structure. Have a good approach first, okay? Then pick up notes. And then you need to make up your mind. Notes, scripts, they're all there just to get an idea what the simulator or what the patient might ask you, how they will pop the question for you, and how you will answer them. It is not to cram, it is not to remember. This is not good because they can make changes to the stations, isn't it? If anyone is knowing all these things already, then why it is difficult to get through sometime? Why? There must be some reason. The reason is sometimes is our approach, isn't it? So try to do that first, then pick up your notes and stick to those notes, okay? And then the best way to know anything, to confirm anything, is to go to NHS website. This is the best thing in regards to the terminology explained in regard to the medications, because there is written in the term how you will explain something to a patient which he or she can understand in a layman language, not the language of a doctor, isn't it? Okay, so use NHS as your second thing to confirm everything. Okay, notes is just to get an idea what is the exam scenarios are, how they look like, how the station goes, how you will go through all of the 16 station, and how you will go through all of the Socrates. It is there, But the problem is that they haven't mentioned anything about your structure. So follow structure, right? You will not be lost, believe me. And then try to practice. How to practice? Practice is not that you are reading the script and you're practicing the same question, same answer. No. Practice is just have the scenario and just practice. How you will ask the patient when the patient comes to you with a complaint of pain. The mnemonic is Socrates, isn't it? The eight mnemonic, the 8-part mnemonic is your base. That's your presenting complaint. If you don't explore all of the 8 questions in that mnemonic, believe me, you will not get good marks in the data gathering. Data gathering is what? It is you presenting complaint. How much you can explore it to get your differential. And if you ask the Socrates in detail, if you ask Oedipera in detail, you will easily get to know what the station is about. But don't skip that part. Don't just jump onto the past medical history and other things. And one of the most important things which we forget while practicing is that we don't acknowledge the expressions. We don't acknowledge the words. And here in England, in UK, we acknowledge every part, every word a person says. Like what, doctor? Well, I'm not feeling well. Oh, all right. Are you okay? If you want, you can share with me. Maybe I might help you with that. See, I'm not feeling well. So there's so many ways to acknowledge this. I'm having pain. Oh, this sounds really distressing. Why are you having pain? Oh, for how long? Oh no. So, did you take anything to make it better? No? Yes. So it is a normal conversation in which you show your expressions, isn't it? So in the exam, the patient or the simulator is the same. You have to acknowledge what he or she is saying to you. Don't ignore anything coming out from their mouth. Everything they're saying is the same for a purpose. Purpose. And if you follow their lead, they will lead you to the correct direction. If they saying anything is negative, anything is no, you don't go that part of the history. That's simple to remember, isn't it? Patient is saying no, you don't go to that part of the history. Just stick to them because sometimes they want you to move forward quickly, to finish your station because they help you. They help you to pass. Believe me, they help you. If you listen to them, listen to them. Listening is very important. Listen, 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 and acknowledge, acknowledge, acknowledge. Nothing else. If you think that you have done your station really bad, and if you have done really good listening, really good acknowledge, acknowledgement to the concern, to the verbal or non-verbal cues, believe me, you will get through this easily. It's not that difficult. You can do it. Okay? You can do it. Have trust in yourself. But first of all, make your base strong. Learn your structures and approaches. Then pick up any notes. There are so many notes. Spire, Samson. Every notes they are the same. But still people are struggling because they don't have a base. So learn your basics, learn your structure approaches, and then pick up your notes Start studying, start practicing. If you still get stuck in between, you can get help. There's so many people around here. You can get help. You can ask me anything. I would love to help you if you need any help from me. I always, I have never said anyone to don't text me. No, I always try to help whoever texts me. No matter, that's okay. If you need me, I'm here. So please try to do like this. Try to study, practice, and then and look at your side and don't follow too many notes. Just pick up one notes and make, if you have time, 2 to 3 months, 3 months, 4 months, make your, why not you make your own short notes about the stations? Do it. NHS site is there, get the help from there, right? Other thing is practice is important. Try to do practice. When you practice with each other, try to be natural. Don't pretend that you are special, you are a patient, you are a doctor. You both are, we are doing communication. The communication should be a two-way communication. It's not like I'm talking and you are listening, that's it. No, if I'm talking, you should acknowledge me. You should at least say yes to yes. At least you nod your head. At least you say to me that you are with me, with your action, with your words, with your expressions. And one of the most thing I want to say that don't use your hands, please. Moving your hands during talking is a bad thing. We don't use your hand when we talk here because we talk with our head. We nod our head. We talk with the eyes, we with the expressions. So don't use your hands when you talk to the patient. This is a very bad habit. Okay? Okay? Because have you seen anyone talking and moving their hands here and there? No. You can use your hand when you want to specify something like, can you please tell me where exactly the pain is? And the patient say, doctor, I don't know. Well, I mean to say, can you point with your finger like here or here? You can say like this. Okay, when the patient doesn't understand what you're saying, you can tell them with your hand. But otherwise, your hands shouldn't be moving during your consultation. Okay, use your use your expression, your eyes, your head. Right, but okay, I'm listening to you. See, it is so easy to do it. Okay, other thing is uh, regarding the stations. There are 18 stations in the exam, 16 stations in which you have to show your skills as a doctor, and in the 2 stations which are the rest station, in which you just go and sit down and chill for the next 8 minutes. Okay, so you can get any station as your first station. You can get either Simon as your first station, or you can either get a rest station as your first station. Okay, so your stations are 16 in which you have to perform, and 2 are the rest. In the 16, one will be Simon and one will be examination. Sometimes it's 2, and one will be combined station or examination station. It could be either come as a examination, like you have to teach some examination to the student. So one will be your teaching station, one will be your combined station, one will be your semantic station, and one will be your procedure station. So sometimes they give you 2 examination station as well. Okay, so be prepared for that. If it is not a teaching, then there must be another examination station for you. Right. And the other station, they are, I think, 6 to 7 or 7 to 8. I'm not sure about the exact number, but it is telephonic consultations. And nowadays they're also doing the Zoom consultations. So the Zoom consultation is the same as the telephonic. The difference is that you can see them. And Believe me, it is good. Why? Because you can read the expressions, you can see the expression, you can acknowledge easily the pain, okay, any concern, whether they are looking into your eyes or not, whether they are looking at you or not. So any non-verbal cues you can easily pick up, isn't it? So it's easy. You know, only difference is that you have to make sure that they are hearing you clearly, and is that you need to ask that, are you, can you hear me clear? Yes. Can you see me clearly, please? Because it is a Zoom. This is a face-to-face. So two extra question in this consultation. Can you hear me clearly, please? Can you see me clearly, please? Yes, doctor. Well, that's fine. So carry on with your same structure. Carry on with your same structure. Don't worry. It's the same, like face-to-face, but there's a screen in between you. Nothing, nothing changed, right? Okay. When you are in the exam situation, be calm. I know it is easy to say be calm, and your heart will be beating, beating fast, 110 beats per minute. It happens. It's natural. Well, go to your stations, read your question properly. If you don't remember the name, that's all right, because you will have the question in the cubicle beside you, so you can always check the name there and confirm. When you ask, can you please confirm the name and age for me, you can always look at your question paper, and you can always look at the name of the person and confirm it. When you are outside the cubicle for the next 1 minute and 30 seconds, try to make your make up your mind how you will start your consultation, what is the station is about, what you need to ask. Okay, don't waste your time that you know the station. Okay, you know the station, it's all right, don't show them. Follow your structure and follow your patient, because sometimes you know that you know the station, but when you go inside, the patient will give you a different concern, and you say, oh, that's a new station. No, concern can change anytime. Okay, so be prepared for that. Don't be a scripted person, be a doctor. A doctor can deal any situation if he knows his structure and approach. He can do it. If you know your basic, if you know how to be a safe doctor, if you know how to pick up any red flags in a patient, you will pass this exam. This is not a difficult exam to do it. Now, the next thing I would like to discuss is that if you think that you have done anything bad, and if you think that your last station didn't go as it's supposed to be, so don't think about it, because there's no time to think actually. You come out of your room, you move to your next station, you have to read your next scenario, so you don't have time. If your mind is still stuck in the last station, how you will read the question and make up your mind for the next station? So try to just forget about it. Always look forward, don't look backward. Okay, so once it's done, you can't go back, isn't it? But you can still go forward and do good, isn't it? So always try to think like this. I know it's hard to say, but it is, you can try, isn't it? Just try it. Always think ahead. Don't look back. Whatever has been done, you will not go back and change it. But you can change your rest of the station, isn't it? If you do good, if you control your nerves, you can do it. It's not that hard. Now you finish your stations, be calm, try to listen to patient, try to acknowledge, and don't try to think that you have to finish your structure. If the patient is leading you, just go with them. No matter you haven't done anything, it's all right. If you have acknowledged the patient, if you have addressed concerns of the patient, believe me, you will get through this. Okay? Because for us, patient is our boss. So if you make them happy, you're happy, right? Other thing is that when you talk to the relatives, when you talk to anyone about anything and he or she is concerned about someone else which is not there in the station, which is not there in the picture, but indirectly they are talking about them, always take history, always ask about them, don't ignore them. Like sometime a daughter is calling concerning about the mother, you should ask about the mother, take a history, because you have to get 4 marks in your data gathering, isn't it? So take your time, take history, and don't forget the person who is calling you. She is calling you, she is having some concern. At least ask her how you are doing. Is there anything you want from us to do for you? Is there anything which I can help you with? Make yourself available to her or him, isn't it? Because she is there. So ask him why you ignore the person who's talking to you and you are just interested in finishing your structure, finishing your history, finishing your station, reaching to the diagnosis. Of course, we have to do it. But first of all, if your interpersonal skills are not that good, then how you will ace this exam? So try to acknowledge the person who is talking to you or who is in front of you, and do get a bit of history about that person. All right. Now, this is about talking to some uh, relatives, all right, or any person who's talking, who wants to talk to about someone who they're concerned about. Now, let's talk about the examination station. Examination stations are easy stations, they're not difficult station. We have all done that in a final year MBBS, isn't it? And most of us, we are still doing it when we are practicing in the hospital or we are working in the clinic. So it is the same thing. The only difference is that you have to learn how to approach here, because you're not you because there are some changes, which there's some differences in the things in our home country and here. So we have to learn all those differences, isn't it? And same as the teaching is not just you go and bombard the student, or your FY1 with all the knowledge you have. No, you have to make sure he understand what you're saying, isn't it? Just suppose if you have to explain a simple thing to your child, a 2-year-old child or 4-year-old child or 5-year-old child, how you will explain to them? You will start with very simple language and then you ask them, do you understand? Yeah, okay. And if you don't understand, if I'm going too fast, if I'm not able to make some point clear, if you think that I'm not understandable to you, please stop me there. I will repeat it. Okay? I'm here to help you with anything. That's your IPS, how I'm talking. If you can talk in this tone, you will get through this easily. It's not that difficult. Okay? Um, Simon. Simon, I just don't understand why we think that Simon is something, something's big, something is scary. What I can say, something is scary, which is scared all of us. The name Simon. Oh, Simon Station. What I'm gonna do? Why you're scared of this station? Simon is just an emergency case because they can't bring any emergency case in real situation. They have put a dummy there, okay? The dummy which has some battery in it. Sometimes it's responding to you, sometimes the other person is talking. It has some batteries which can show you, which can make you feel that he's breathing. heart is breathing, lungs sounds, pulsations, okay, bowel sounds. So why you're worried about this? You still need to follow your approach. But most of the important thing is that the patient is in a difficult situation. It is a most emergency situation for the patient. Your IPS, your acknowledgement, your tone is very, very important. You will make sure the patient is safe. You will make sure the patient is fine. If he needs oxygen, give him oxygen. If he needs fluid, give him fluids. Your job as a junior doctor is just to make sure you do your basic things, which are basic investigations, basic treatment, IV fluids, oxygen, antibiotics, and painkillers. Don't forget the painkillers. Most of the time, people forget painkillers. Why? Oxygen, IV fluids, antibiotics. Why we forget all these things? This is our job to make sure we give if they need. So Simon is nothing, it's just an emergency case which you have to deal. That's it. It's nothing special. It's nothing to worry about. Like you check, like you do face-to-face consultation. Just suppose it is a patient lying on the couch and he is in an emergency and you have to treat him and it is an emergency situation. You have to do everything quickly. That's the only difference in this situation because you have to do it quickly so that you can give the patient what he needs. You will not let the patient die. Okay, that's it. And practice, practice, practice. Stick to one thing and try to stick to it. If you have time, make your own notes. The best site is NHS, okay, to confirm anything, to learn anything. I must say, okay, practice with different people. Don't stick to one person because then you don't know about the tone, about the accent, how because every person talks in a different accent, isn't it? So you will get an advantage because here most of the time the people struggle with accent. They don't understand what the person behind the door, behind the next door, behind the next wall is saying to you, like in the telephonic consultation, because you don't understand the accent of the patient. And try to speak slowly. Don't rush. Don't rush. Don't rush. Okay. You see how I talk? I talk really slowly when I give any lectures, when I talk to you while I'm doing the mocks, when I teach you something. Even now, I'm talking to you. I'm talking, but I'm talking clearly and I'm giving some pauses in my conversation. That's how you talk. And still, I'm maintaining my tone. Still, I'm showing my expression through my voice, isn't it? This is the communication skill you need to get through this exam. Okay? And try to practice. Don't don't think that you can't do it. You can do it. Okay? If you need any help, you can always text me. Always pop any question in the group. I will answer your questions. I never say no to anyone, believe me. And the last thing, we are doing some IPS courses. If you want to join, you can join because the small things will make a difference in your consultation. Sometimes we don't know, we just know that I'm sorry to hear that. I'm sorry that you're going through this. I'm sorry. I'm sorry, the word is not enough to say and to express the sympathy and empathy. It is more than saying a sorry to a person who has lost his beloved one. Okay, so learn it. You can join the group. The link will be in my YouTube channel videos. All right. and you can ask anything in the group. We are starting our revision course very soon. It is a 10 days revision course. We will be covering most of the 100, more than 100 stations, but my style is to first of all to teach how to approach the particular station, particular type of station. So first of all, I teach approach, how to approach that particular station, like if it is an ethics station, if it is an breaking bad news station, because I will not teach you all of the 1450 station, but I can teach you approach which will help you to do every station, isn't it? And the other thing we are doing is examination, and sim course is also there, and our lab 2 course is coming soon. Okay, so stay tuned. And the last but not the least is, please be yourself, be a safe doctor, right? And acknowledge your patient. Don't ignore it. Don't ignore this word, acknowledgement. It is very, very important. Okay, and stay safe. And if you need anything, if you want to do any specific stations, because one more thing is that, in my group, I do two mocks every week, for, like, it is group mocks for all. Okay, so it's for everyone who want to perform, who want to join, most welcome. And I will still teach you the same way. I will still guide you from your first word you said until the last word you said when you finish your station, because I don't let the things let go, and I try to explain the thing till you understand what is the code of the station, what you need to do. And that's it. I hope that that's a small uh, audio video which I have made today will be helpful to you. If you need anything, you can pop any question in the group. All right. Thank you so much for listening to me, and stay safe. And one and the last thing I want to say is, learn it, don't cram it. Okay. Learn your structure and your approaches. Don't cram, don't cram your notes, because you will forget everything when you're in the exam. Only you will know your basics. Thank you so much. Have a lovely evening. Good night.